Mercury poisoning is the result of being exposed to too much mercury, either through the diet or environment. Mercury is a heavy metal that is highly toxic to humans. Consuming food that contains mercury is the most common cause of mercury poisoning. Mercury poisoning can cause severe symptoms and put the body at unnecessary risk. A person can help prevent mercury poisoning by making changes to their diet and environment that limit exposure to the toxic metal. What is mercury poisoning? Mercury poisoning may lead to neurological symptoms. Mercury is a naturally occurring metal that is in many everyday products, albeit in tiny amounts. While this limited exposure is usually considered safe, a buildup of mercury is highly dangerous. Mercury is a liquid at room temperature and readily vaporizes into the air around it. It is often a byproduct of industrial processes, such as burning coal for power. Vaporized mercury can make its way into the rain, soil, and water, where it poses a risk to plants, animals, and humans. Ingesting or coming into contact with too much mercury can cause symptoms of mercury poisoning. Symptoms and early signs. Mercury may affect the nervous system, leading to neurological symptoms such as nervousness or anxiety, irritability or mood changes, numbness, memory problems, depression, physical tremors. As the levels of mercury in the body rise, more symptoms will appear. These symptoms may vary depending on a person's age and exposure levels. Adults with mercury poisoning may experience symptoms such as muscle weakness, metallic taste in the mouth, nausea and vomiting, lack of motor skills or feeling uncoordinated, inability to feel in the hands, face, or other areas, changes in vision, hearing, or speech, difficulty breathing, difficulty walking or standing straight. Mercury can also affect a child's early development. Children with mercury poisoning may show symptoms such as impaired motor skills, problems thinking or problem-solving, difficulties learning to speak or understanding language, issues with hand-eye coordination, being physically unaware of their surroundings. Mercury poisoning tends to develop slowly over time if a person comes into frequent contact with mercury. However, in some cases, mercury poisoning comes in quickly and is associated with a specific incident. Anyone who experiences a sudden onset of mercury poisoning symptoms should call a doctor or poison control. Doctors can usually diagnose mercury poisoning through a physical exam and blood tests. Doctors may ask about any symptoms the person is having, as well as for a general breakdown of their diet. They may also ask questions about the environment the person lives or works in, including whether they live near any factories or work in an industrial plant. If the doctor suspects mercury poisoning, a blood and/or urine mercury test can gauge the levels of mercury in the body. Treatment. Treatment of mercury poisoning involves eliminating any and all exposure to the metal. Doctors will recommend that the person does not consume any seafood that contains mercury. If mercury poisoning is related to a person's workplace or environmental exposure, doctors may suggest that the person change their environment to reduce their exposure, or that the workplace puts new safety measures in place. Mercury poisoning may cause some long-term side effects, which will be treated or managed individually. Certain types of severe cases of mercury poisoning may require chelation therapy. This is the process of removing mercury from the organs so the body can dispose of it. The drugs used in chelation therapy bind to heavy metals in the bloodstream and are then eliminated in the urine. Chelation therapy comes with its own risks and side effects, so it is crucial to use the medication only when necessary. If you like the video, kindly subscribe in this channel. Baby Time FYI. Thank you.